Hey everyone, I'm going to talk about the peritoneal mesothelioma or metastatic of the peritoneum. So basically, the liver function tests that are related to. First of all, here's a scenario: a 40-year-old female who presented to the emergency department with a worsening abdominal pain and distension over the past 2 months. Examination revealed a distended abdomen with a protruding umbilicus and positive shift in donor. So this is indicates that there's an ascites, which is like something that is related to the metastasis or malignant of the peritoneum. CT of the abdomen revealed massive complex ascites, right? Okay, the following laboratory test results were obtained. There's the hemoglobin is sort of anemia because sort of malignant. So it has to be related or accompanied with anemia. Platelet is normal, the PT is normal, ANR normal, everything basically is normal like ABTT, protein, albumin, ALT, AST, GGT, but so basically, all of the liver enzymes are normal, but once it gets to the ALP, it's not a normal at all. And that basically, ALP is related to the gallbladder, right? And those two enzymes are related to the gallbladder. That means once they are elevated, there is a problem in the gallbladder, right? But in this case, we only have one elevation on the ALP, and that something indicates that there is a malignancy or metastasis, because it is only thing that is elevated, not just and not at the GGT. Basically, the the GGT is more specific for the gallbladder, right? But ALP is not as specific for the gallbladder. That means it's sort of um like it could be for the pound, for the RBCs, for even though the pregnancy, I think so. So it has so many things to be elevated with. It's not as specific for the just gallbladder. So just and once it all elevated upon all of these or out of all of the liver enzymes, that gives us an indication that there's a case of malignancy or a just malignant tumor, unfortunately. So because it is alone has elevated, we're gonna think about malignancy. That clear so far. Normal interpret the previous LFTs, normal liver function tests. ALP is from non-hepatic source, normal GGT, okay, just I told you, mostly from the bone metastasis. What is your diagnosis? Basically, it's going to be peritoneal, mesothelioma metastatic condition. So peritoneal mesothelioma is a sort of thing that affects the peritoneum of the abdomen, a sort of malignant tumor. Okay, and once there's this condition, we're gonna find the ALP is so elevated with. How can you explain the elevated ALP? Well, alkaline phosphatase is usually only moderately elevated. Marked elevations suggest extrahepatic cholestasis and prompts imaging tests, ultrasonography. Like ALP, once it is moderately elevated, it indicates the problem is related to metastatic or malignant. Because once it is markedly elevated, the problem going to be from a gallbladder. But in this case, it's moderately elevated, we're gonna think about the malignancy. Okay, so just the value here where, or it was a 570, which is moderately not so high though. It is not 1,000 or 2,000. Okay, comment on the ascitic fluid analysis result on the SAAG. Okay, so the SAAG, serum ascites albumin gradient, serum ascites, okay, the albumin from the serum, from the ascites albumin gradient. Gradient means difference. So it is the difference between serum albumin and albumin in the ascitic fluid. It is used to discriminate the etiology of ascites. If over 1.1, it is in the context of portal hypertension. If it's under the 1.1, it suggests peritoneal causes. The gradient is difficult to use in patients with very low serum albumin. So basically, this SAAG determines the cause of the ascites. Okay, in our in our case, just the um, just this is the albumin, the ascites albumin, which is 3.2. Okay, and just it has to be first. Okay, but just doesn't matter. Like 3.9 is with the of the serum. So the result is 0.7. It is less than 1.1. It's not a hepatic cause because once it exceeds 1.1, it could be from hepatic cause. And in our case, it is not from the liver. The disease isn't in the liver. The disease in the peritoneum. Okay. All right. So this is low SAAG and high SAAG. Once it is more than 1.1, it is high, and once it is less, it's going to be low. These are the causes. It's going to be extrahepatic or like a malignancy, infection, trauma, pancreatitis, etc. Once it exceeds 1.1, it could be hydrostatic pressure or like a less of the oncotic pressure. Like once it is hydrostatic pressure, it means like a sort of like there is I think a loss of proteins, and the same here. Okay, so these are some causes that related to the liver, whether increase in the hydrostatic or decrease in the oncotic pressure. How can you diagnose SPP in hepatic ascites? Well, it means spontaneous bacterial peritonitis. Spontaneous bacterial peritonitis, sort of infection that affects the peritoneum or the peritoneum is an infection of ascitic fluid without an apparent source. Manifestations may include fever, because it is an infection, malaise, accompanied with the fever, symptoms of ascites, and worsening hepatic failure, because the liver is in the abdomen, so that's why. Diagnosis by examination of the acidic fluid, way, just gives us like a once you withdraw the fluid from the abdomen, there's going to be an infection. Treatment is cefotaxime or another antibiotic. So because there's an infection, bacterial infection, we're going to treat it by antibiotic. So this is the SBP and just the SAAG. Most like important things here. Okay, to recap, just the peritoneal mesothelioma. Okay, sort of metastatic of the peritoneum. And the liver function test going to be elevation only of the ALP, and it is not so high elevated, so it's going to be moderate elevated. So the SAAG going to help us to determine the cause of the ascites. that is accompanied with the mesothelioma. So, and in our case, it is not a hepatic cause because it is less than 1.1. So once it is more than 1.1, it is hepatic cause, and once it is less, it is not a hepatic cause. Could be like any other cause. And this is some important infection that affects the peritoneum. Okay, with that being said, thank you so much.